Hello, everybody. It's Dr. Chris Mascetta with Ridgefield Chiropractic and Wellness Center. I want to welcome you all to another edition of Ridgefield Chiro Live. I apologize. I have a little crackly voice. I've been fighting something I think that we've all been fighting, but feeling great, just don't sound too great. So if you could bear with me. But anyway, this is my first show of the year, so I hope everybody had a really great holiday season and had a fantastic New Year. I'm excited to be back. I'm excited to start the new year. We've got a lot of really exciting things going on in the office. One of them being I want to do more of these videos. Anyway, so this is the first time also using StreamYard. So hopefully I'm streaming live on Facebook, YouTube, and I think what is the other one? Anyway, I guess it doesn't matter. But anyway, hopefully I'm on all three. So what I want to talk about today is to really how to get the best results from your chiropractic care. And, first off, it's a really simple answer. And that's really to stick to your care plan and understanding your care plan. Most people that don't get the results that they're looking for are just not adhering to my recommendations or the recommendation of the chiropractor. And it's really easy. So what I wanted to explain is the three different phases of chiropractic care, because that's typically what the treatment plan is based on. And if you have a better understanding of that, maybe you'll be more likely to adhere to and get better results. So anytime we have a new patient who comes into the office, or maybe it's an existing patient who's experiencing a new condition, a new injury, we recommend three different phases of care. Now, obviously, it's always up to the patient how long they want to benefit from chiropractic care. But if they truly want to get the best results, we recommend adhering to all three different levels. And I'm also going to talk about which one of those three phases of care I think is the most important. So they're pretty self-explanatory. So the first one is pain relief. The second one is corrective care, and the third one is maintenance or wellness care. So let's start with the first one. So pain relief. So what's the goal of the first phase? Obviously, it's to reduce the pain that the patient came in with. So obviously, we're going to do a course of chiropractic care because that's what we do, and it's the most important service that we provide in the office. But we also may do a lot of passive modalities when we're in that phase of care, including things like electrical muscle stim, ultrasound, hot packs, cold packs. We have a cold laser. We have shockwave therapy. So things like that. So when the patient's more acute, those are great ways to calm down the symptoms. But obviously, that's not the most important thing. It's most important to get the patient feeling better. But we really want to fix the underlying problem. And therefore, the second phase of care is corrective care. And corrective care is exactly what it sounds like. We're continuing to work on the patient. Maybe they're feeling a lot better, maybe not 100%, but for the most part, the symptoms are under control. So corrective care is a continuation of chiropractic care, but also we're doing more active modalities as well. So we may introduce a lot more stabilization type exercises, postural exercises, core stabilization, flexibility. We may talk a little bit more about their workspace, ergonomics, things that they can do outside the office to stabilize the spine, and we can correct the underlying subluxation, the underlying structural problems. A question I get asked a lot is, well, how long does this all take? And that's very individually based. So if you come in with a problem that's been chronic for a really long time, maybe there's a lot of degeneration or arthritis or adhesions in the soft tissue, obviously that's going to take a lot longer to get the results compared to somebody who may not. It may be more acute. Maybe it's more of like a muscle strain. Maybe they're younger. They don't have the history of the injury developing, and therefore usually we can get through the pain relief phase pretty quickly, and maybe the corrective care more quickly. The third phase of care is what we call maintenance or wellness care. And to me, I think that's the most important phase of care because, we've got you out of pain. We've worked on correcting the underlying problem. Now we want to maintain it. If you come in periodically, and that varies for everybody, the golden rule is usually like once a month. Sometimes that's not enough for some people. Some people maybe can go a little bit longer. We decide on that once we get there, or what the patient may be looking for out of their care, obviously. But to me, it's the most important phase of care because it's not going to allow, or it's going to slow down the continued degeneration of the condition. So if you have some arthritis in there, that arthritis is probably going to continue one way or the other. So it can either continue the path and continue a little bit quickly, or we could really slow it down through a lot of lifestyle changes and maintaining that normal structural control, movement patterns, weight bearing, things like that. So getting adjusted periodically will slow down that rate of degeneration. It'll also reduce the likelihood of flare-ups of pain. It doesn't mean that you're never going to have pain again, but if we're already on top of it, it means that usually one, it's not as severe, and usually we could manage it and take control of it, a lot sooner than if you hadn't been in for a year. I tell people, look, you're probably going to need to see the chiropractor 12 times a year, one way or the other. You either do 12 visits all at once or once a month for 12 months. It's up to you. But certainly doing it once a month's a lot healthier because it keeps you healthier. It also, why it's so important to me, I feel as if you really start to get the true benefits of chiropractic. So chiropractic, it is great for pain relief. There's no question about that. But it's even better for improved health and well-being. It stimulates the nervous system. Correcting subluxation stimulates the nervous system in a way that's going to enhance how well the body is working. It's going to be more efficient at adapting to stress, and just work more optimally. It also boosts the immune system. And there's a host of other benefits to it. And I feel like when you have those underlying subluxation corrected for the long term, your health is going to be a whole lot better. So we could do a whole other show on that. But to me, that's the importance of chiropractic and why you really, truly want to see a chiropractor. Talking about stress, understanding the benefits of the 3 phases of care is one thing. But another thing I talk to my patients, and I kind of learned this from my own chiropractor because he says this to me almost every time I go in. And yes, I do get adjusted. I get adjusted. I try to get adjusted once a week, once every 2 weeks, just for my own health and physical well-being. But anyway, he always asks me, well, what did you do to sabotage yourself, since the last time I saw you? And I think that's a great way to put it. So, I incorporate that into care as well, asking patients, think about, what ways are you sabotaging the care in the office? If we're not getting the results that we want, what are the things that you're doing outside the office that's going to interfere with the benefits of the chiropractic care? And the best way to look at that is looking at stress patterns. Number one, obviously we're chiropractors, so the easiest way to think about is physical stress. What are you doing from a physical standpoint? Maybe you're working out too hard. Maybe you're working out too much. Now, obviously, the goal as a chiropractor, especially sports chiropractors, I want you doing the activities that you want to do as much as you want to do them. But there is sometimes a limitation to matter, and maybe you are overdoing it, or maybe you're not using the correct form or posture, or maybe a little bit too much weight, a little bit too much reps, or going from one class directly into another class, doing 2 workouts a day could be a lot unless you're really an elite athlete or a college level athlete or something like that. So that could be a sabotage. Maybe your workstation, maybe you're sitting way too much, maybe you're standing way too much, lifting, twisting, things that may be putting undue stress or pressure on your spine or your body that might be, reducing the benefits of chiropractic care. And in those situations, a lot of times what I explain to a patient or tell a patient is, it's kind of like stubbing your toe and then continuing to kick the same wall, but expecting it to feel better, expecting it to get better, even though you're doing the same thing over and over and over again that injured it in the first place. So sometimes we just have to look at those things. The other 2 big ones are, what are you putting into your body, nutrition wise? Are you getting adjusted and then running out and getting a Big Mac? That's not going to do you any good. You want to put good nutrients into your body, maybe look at different types of supplements. That to me, the best way to get nutrition to your body is through a really healthy diet. But unfortunately, the quality of food isn't really all that great. And our absorbability isn't that great because our guts have been beat up for so long from the crappy food that we've been eating or stress in our body. So a lot of times it does take sometimes supplementation to just kind of get the proper nutrients in your body, and then just clean eating, avoiding foods that are inflammatory to the body, hydrogenated fats, trans fatty acids, refined sugar, refined grains like flour. All that stuff is really bad. Reduce maybe alcohol consumption. Are you drinking too much? All these things are going to have adverse effects on the body and put more wear and tear on the body and cause increased subluxation. The last one is stress. I think that we're all under a tremendous amount of emotional stress. There's a lot going on in this world. I know people are busier than ever. with work and, that type of wear and tear. Just think about if you're stressed, all these muscles are engaged, or you're depressed, you get into this type of bad posture. But it's also overloading our circuits neurologically. And if you're not, getting adjusted and resetting the nervous system, it's going to have an effect on you. So again, those are things that might be sabotaging your overall health and well-being and the benefits that you're getting out of care. So anyway, so this has been about 10 minutes. I talked kind of fast. Hopefully you got the gist of it. So just to recap, the ways to get the best care or the best results out of your chiropractic care are to adhere to the treatment plan. There's a reason why we recommend what we do. Number one, pain relief. Number two, corrective care. Number three, wellness or maintenance care. And then also just look at things that might be sabotaging your health from a physical standpoint, a nutritional chemical standpoint, and to an emotional standpoint. So anyway, I hope you found this video helpful. Hoping that, LinkedIn was the last social media outlet that this is on. So hopefully this is posting on all three of those forums. And we're going to do more of these videos. If you have any requests, let me know. And otherwise, we'll see you next week. So hopefully this went well, and we'll talk to you soon. Thanks. Have a great night.